Hello friends, very good morning. This is Dr. Mishra. Today's topic we will discuss regarding canine parvoviral diarrhea. This is very important to know that nowadays there are many pups which is being encountered with the problem of loose motion. It may be from watery to semi-solid. Even sometimes you can get bloody mucus tinged discharges. So this is very common, and most of the pet owners, whenever they come to me, and they have the complaint that the the stools are very stingy in paste, as well as the smell is very offensive. So this is the first indication that you can able to say confidently to your pet owner that definitely your puppy is having parvo infections. So let's discuss this important disease for puppies in detail. Canine parvovirus infection is one of the most lethal disease affecting young dogs. It is highly contagious, while life-threatening outcomes will be there if left untreated. It is one of the most significant and well-acknowledged disease known to almost all experienced dog owners. It is because of this disease, with alarming death statistics all across the continent, veterinarians always recommend their pet owners to look after the newly born puppies, or even purchase one, about their vaccination and hygienic methods very carefully before rearing. I'll tell you, one thing. Please remember, everyone, that all dogs are not more predisposed to this disease. But one thing is very important. The age factor is a critical factor in deciding the infection. Mostly, if puppies from 6 weeks to 6 months of age are more predisposed to this dangerous infections. So make sure that if you are bringing new puppies to your home, yeah, ranging from age of 1 month to 6 months, roughly. So definitely she or he may get infected if there will be some problems, some outcoming factors or environmental factors which is contributing for the growth of this infection. Even if you talk about susceptibility of dog breeds, I can say that moreover, a few breeds are more predisposed, but likely factors which is contributing to the infection of this disease is various things I will discuss just now. But before that, I will tell you, few breeds are more predisposed, just like Rottweiler, Doberman, Bull Terrier, or German Shepherd. They are more predisposed. So if you are buying either of these breeds, so you have to be extra vigilant about their hygienic maintenance. Okay. And now let me tell you few factors which are responsible for occurrence of this outbreak, this disease, you can say. First one is early weaning. Early weaning means separation of puppies from mothers. This is very important factors. Apart from this, there are overcrowding, malnutrition, warm overload, acquired infections. Born puppies should be with mother for a minimum period of 2 months at least. It is recommended to vaccinate regularly the mother dogs so that born puppies will have acquired antibodies from few days to few weeks to fight against infections. It becomes very essential in case of non-vaccinated puppies. Always remember, puppies for sale should be at least 2.5 to 3 months old and duly vaccinated. If not vaccinated, at least make sure his or her mother was duly vaccinated before the purchase. Vaccinate your puppy if not done, but give a gap of at least a week if it was transported a large distance of more than 100 kilometers. And now, how to find out some symptoms you must know for identifying your puppies, or you can get easy or early access with your veterinarians to save her life. Non-specific signs like weakness, off-feed, fever develops early, that later accompanied with signs of vomiting, dehydration, loose motion with foul odor that may aggravate to bloody mucus discharge in critical cases. Parvovirus affects mainly gastrointestinal system along with the lymphatic system that brings down body immunity. Sometimes in advanced stages, it affects bone marrow and cardiovascular system. As far as treatment is concerned, you have to call your vet urgently. There is no excuse at all. It is an emergency situation, right? As it is highly contagious, healthy pups will get infected very soon. So it is advisable to separate the infected puppies from healthy ones till their recovery. Now coming to the prevention and control, first one is regular vaccination is mandatory. It is must to counter these infections. It is recommended to vaccinate your puppies with following schedules. First vaccines has to be given at around 6 to 8 weeks of age. Then after a 1 month period you have to give the first booster. Then again after 1 month you have to give second booster. After giving the second booster you can go for annual vaccinations for 3 to 4 years, and then you can go for vaccination once in 3 years for a lifetime. At least you have to follow this schedule for a period of once your dogs becomes 5 to 6 years of old, at least minimum. Next important thing is to avoid wormhole or to avoid secondary bacterial infection or to avoid increasing the immunity of your puppies. You have to deworm your puppies regularly. Usually most of the dog owners, they are not well versed regarding deworming, so it is advisable they should learn about deworming. If you're not getting anything, just consult your veterinarians, or if at all you are not able to get consultation from your veterinarians by any reasons, you just remember you have to take albendazole or parental combination of medicines, whichever is available at the counter, and go for deworming. Other reason for prevention, you have to take care about keeping your house clean. It is important to note that parvovirus is very resistant and may survive in the environment from months to years, and so proper house cleaning is must. A parvo outbreak house must be thoroughly cleaned twice daily with disinfectant like bleaching powder or hydrogen peroxide regularly. Then moving to next, isolation housing for sick puppies is very recommended. Sick puppies must be kept in separate house away from healthy ones till their complete recovery. There should be separate gown or cloths for owner who is handling sick puppies, and it should be regularly cleaned. Then now if you are bringing new puppies to your old home where you have been encountered with the same problems with your old puppies, so it is advisable that new puppies has to become after thorough cleaning of your house, especially 4 to 5 times by bleaching powder or by using hydrogen peroxide, and until the old puppies which has been infected, they have been get cured, until then you should not bring new puppies. This is very important to avoid acquired infection from those puppies, because these viruses are very resistant and they are setting into the feces of sick puppies for months to years. Even they become resistant for a while, but new puppies which has never been encountered with such situations, he may get infected very soon. So if you are following these guidelines, I'm assuring you that you will not find any problems in futures regarding caring of your dogs regarding parvo infections. If you're having any doubts more than this, you can get me on my personal websites dogandvet.org, or you can also ring my WhatsApp number 8874829298. So stay tuned. Thank you.